Well, more than 200,000 people in the U.S. have now died from the coronavirus, a number that was almost unthinkable, really, just a few months ago.
That's right. Those deaths make up about 21% of the world total, despite the U.S. having just over 4% of the world's population. And now some models suggest that we could see that number nearly double to nearly 380,000 deaths by January if current conditions continue.
But if nearly everyone wears masks in public, we're told nearly 115,000 lives could be saved. And it comes as researchers at Johns Hopkins University have released a new kind of COVID-19 prediction model.
And WJZ's live Rachel Minitoff explains how this model can forecast whether or not a patient's condition will likely improve or deteriorate. Rachel.
Denise, this model looks at a set of factors when a person comes into the hospital with COVID-19. Some of those include age, body mass index or BMI, vital signs, and lung health. And doctors are able to use this information to predict how the patient's condition will progress. Can you start by telling us a little bit about your research and how you were able to create this prediction model?
We've been able to utilize an existing platform at Hopkins called the Precision Medicine Analytics Platform, or PMAP.
Dr. Brian Garibaldi is an associate professor of medicine and physiology at Johns Hopkins and a lead researcher in what's called the COVID Inpatient Risk Calculator. It uses information from medical records of patients who have been diagnosed with COVID-19 to understand what happens throughout a person's experience with the disease.
This particular paper was to understand how patient trajectories can change based on factors at presentation to the hospital, things like their age and their underlying comorbidities, but also their initial lab tests and vital signs.
This allows doctors to anticipate what might happen to a COVID-19 patient when they arrive at the hospital, informs decisions about the level of care he or she might need, and how to allocate resources, especially in the event of a surge.
And really make sure that as providers and as health systems, we understand who the vulnerable people might be, and we engage them in discussions about how to get them the care they need, but also understand what their goals and their preferences are as they interface with the health system.
Dr. Garibaldi says the next step is to use this information to create a model that can predict how a patient's condition will progress day by day and even more precisely minute by minute of their hospital stay. We're live outside Johns Hopkins Hospital. I'm Rachel Minitoff for WJZ.